and thank you for joining us for another episode of Hope for Healthcare with Dr. Katie Cole in partnership with ICD Healthcare Network. Dr. Katie Cole is a holistic physician, organizational well-being consultant, and change agent, working with industry leaders and proven strategies to heal our national healthcare system and our culture of medicine. Stay tuned to hear today's speaker.
Well, welcome everyone to Hope for Healthcare. This is a podcast in which we interview expert leaders around the country on best practices for healing our national healthcare system and our culture of medicine. I want to extend a very warm welcome today to Dr. Christina Maslach. Dr. Maslach is the pioneer of research on job burnout, producing the standard assessment tool, the Maslach Burnout Inventory, award-winning articles, and several books, beginning with Burnout, The Cost of Caring in 1982. Her research and achievements over the past 5 decades have led to multiple awards from the National Academy of Sciences, Western Psychological Association, Society for Personality and Social Psychology, and many others. In addition, she has received awards for her outstanding teaching, including USA Professor of the Year in 1997. She has been a professor of psychology at the University of California, Berkeley since 1971, having completed her doctoral degree at Stanford and her college education at Harvard. She is now a core researcher at the Healthy Workplaces Center at UC Berkeley and resides in San Francisco. Well, welcome, Dr. Maslach. It is truly an honor to have you with us today.
Oh, well, thank you so much. I'm glad we were able to do this.
Absolutely. And I know I met you briefly last January at the Burnout Symposium in San Francisco. Right. And you spoke on the topic of burnout. And, you know, burnout has become such a hot topic over the past, especially the past several years in healthcare with our unfolding global pandemic. Would you mind going into detail about the definition of burnout and why it's important for us to understand this?
Right. Thanks for that question, because as you probably know, burnout gets used by people to mean all kinds of different things sometimes. So trying to be clear on what we mean by, job burnout as we see it in healthcare, I think is important. So the first thing to say is that, before defining it, is to say that burnout is a response to chronic job stressors in the workplace that have not been successfully managed. Mm-hmm. And what that means is it's a basic stress response, which all human beings have, thankfully, to respond to threats and challenges. But the fact that it's chronic stressors is really an important point, because we don't recover as well and come back as well from chronic stressors. That means they're high frequency. They're there most of the time, every day, the pebbles in your shoe that just wear you down, wear you out, erode your soul. But as World Health Organization said, that the stressors have not been successfully managed, has an optimistic note of they could be. We could do something about these and make it less likely that this would happen in some way. So there's, sort of a positive note about that. Now, the experience that people have when they have this kind of burnout in response to those chronic stressors reflects a mismatch between them and their job. Mm-hmm. And so there's really 3 interrelated components of the experience. One is the stress response, which is exhaustion. And this is, you just are so overwhelmed and tired and can't, get up in the morning and, get going for the next day. There's basically too much work to do and not enough resources, time, people, equipment, whatever, on that. So that's one. So it's a stress response, but there's more to burnout than that. The second part of it, which for me is really the hallmark of burnout, is this growing negative, hostile, cynical, take this job and shove it kind of attitude about the workplace and your functioning in it. And what's important about that is, as you begin to withdraw from the workplace, you begin to try and switch to doing the bare minimum. You're not really trying to push to do your very best. So it has real consequences for everybody else, whether it's patients or colleagues or, whoever who are affected by that change in behavior because of this cynicism, And the third thing we see is a negative response, not just to the job, but to oneself. Mm-hmm. And what's wrong with me? Why can't I handle all of this? Particularly people have often talked about people in healthcare being more perfectionistic. You're expected like, oh, you've got to save everybody and do everything and, whatever. And if you ever fall short in some way or feel that because you didn't do your best or whatever, it's a sense of your own professional effectiveness. Okay. And that can lead to anxiety, depression, not wanting to get out of bed in the morning
Yes.
to face another day.
Absolutely.
So that's the burnout experience, the exhaustion, the cynicism, and the drop in, professional effectiveness on that. And when you get those three together, then we're really talking about a bad case of job burnout.
Oh, absolutely. So Christina or Dr. Maslach, either.
Christina's fine.
Yeah, I forgot to ask you that ahead of time. So Christina.
Yeah.
So what you're really saying is that we have a normal, valid human response to chronic workplace stress.
Right.
It's consistent across cultures, even globally, right? As human beings, this is the triad of symptoms that we experience in response.
Yeah, we see it in many different professions. I mean, we started doing research on this decades ago, and healthcare was certainly in there as one of the ones that was already talking about it and raising the issue. But we're seeing a similar phenomenon in a lot of different professions, whether it's teachers in schools or tech workers or, people in financial services. I mean, there's just, and we see it in different countries. Mm-hmm. There's been a lot of global research as well as been done on that. And so yes, that kind of interrelated exhaustion, cynicism, drop in effectiveness is, that's really the bad situation we call burnout.
Absolutely. And, the definition of burnout encompasses both the systemic factors as well as the individual factors. So the individuals are having this human response to the workplace environment and the culture.
Right.
And so I really like how you're able to distinguish between the two in your definition.
Yeah, no, that's good. We're all working in a context, in the environment, and it has an effect. We need to recognize those.
Well, and, our audience, probably most everyone in our audience knows who you are. And we know that you created the Maslach Burnout Inventory. Can you briefly review for us what factors that looks at with a healthcare organization or any organization, in fact?
The MBI, the Maslach Burnout Inventory, was designed as a research measure. It was, after doing interviews and observations in places, and I was talking to one of my colleagues who's an expert in developing tests, like this, and he said, you're hearing a similar story, and you probably need to develop a measure that would get at that so you can really, take your research to the next level. And with his guidance and help, that's what I did, along with a graduate student of mine at that time, Susan Jackson, who's gone off to be a wonderful professor on her own in work issues. And it was out of that research for many years in the 70s and 80s, early 80s, that we developed the measure and discovered that those three components were actually important. We didn't start out with that as a definition. It actually emerged from the research. We knew that there was a stress involved, but we thought somehow it would all maybe come out in one score on a measure, but it didn't. And it kept, and as it got translated, and we had other colleagues in other countries doing the same thing, they were finding the same three. So that gave us additional evidence that, okay, we're on to something stress related, but a little different, and we need to understand that. So a research measure is meant for discovery. In other words, it's not like a medical test. which many people unfortunately think it is. Oh, I'll just take the test and see if I'm ill with burnout. No, it's supposed to be, or people will say, I had everybody in my organization fill out the test. Tell me what it means. And I'm saying, but you didn't ask them any of the questions, like, where they work or the kinds of, stressors they face or anything like that, that tells you that burnout goes up when this happens, but it goes down when that happens, So it's really more a discovery measure. It's not meant to be a clinical diagnostic tool. There's no clinical data that actually does that. And in fact, it's not a clinical medical disease. It's not a mental illness. And a lot of people assume it must be, and it's not. And even the World Health Organization says it is not a medical disease. The American Psychiatric Association, you probably know, will not say this is pathology, So it's can people get to a point of struggling to deal with it or feeling really bad and depressed? Can it lead to other health problems like stress does? It can lead to heart attacks, it can lead to other kinds of things, but in and of itself, it's not, this medical or illness or mental disease. And so it's wonderful to be able to use it in addition with other information to say, does this help us understand why it's occurring or where? If I can just add a little point here, to the extent that people focus on saying who is burning out, who are the people, that we need to help, that we need to cure, that we, whatever, or fire, from the job, whatever. You're going to get who answers in terms of treatment or take a long weekend or do, all of this kind of stuff. But it's the wrong question. It's why are they burning out? Yeah. And we need to ask why. And that's where we need to look at the chronic job stressors. We need to look at what's going on in the environment, in the work situation, and say what's working well, what's not working so well. And the why questions will give us a better sense of what we might do about it rather than the who. The who question also points a finger at people and blames the victim. I can't tell you how many people it's kind of like, well, what's wrong with you? I don't think there's, everybody else isn't complaining. Well, maybe they know not to complain because they will get the finger pointed at them too. But if you're blaming the victim and blaming it adds to the stigma, it adds to the reluctance of people to kind of raise their hand and say, wow, this is really stressing me out. Could we do something different? Is there a way to improve this? So I think we need to not use the measure itself as a way of saying it's about an individual problem. Individuals may be giving us information, but when we aggregate it and look at it from different angles in terms of who the people are, where they're working, it's a different job situation for women with children, and who are mothers, of youngsters or something, as opposed to those whose children are grown or don't have. So you need to take into account a lot of things that really are relevant to the match or the fit, between people and their job, and that will change over time. And so it's sort of a continuing, okay, what would be best now?
Yeah. And, well, actually, for the audience, Dr. Maslach has a new book coming out. It's called The Burnout Challenge. And I was lucky enough to get a copy of this for today to look at. And, it's a wonderful book. And she really outlines with her colleague, and I'm going to mispronounce his name probably, but Dr. Leiter.
No, you're right. Michael Leiter.
Okay.
Yeah.
And they co-authored this book, and they really outline the definition of burnout, how it's impacting healthcare, along with other organizations globally. And they go into even change management processes, which I particularly love. And, really what you address is that it's going to take a whole system approach to resolving burnout, right? So of course, 20% of burnout is related to individual factors versus more 80% is systemic, organizational, we've talked about, I think. And so I guess what you were talking about earlier, like taking, getting enough sleep, trying to stay healthy, learning mindfulness, that can all be helpful in terms of maybe creating a little bit of a buffer between your workplace and you. But until you address the pebbles in your shoe, right? Or the system factors that are creating the stress, it's not going to have much of an impact.
Yeah. Yeah. No, that's true. That's true. And I think, I mean, basically what we see a lot of happening is efforts to help people cope,
Right.
which is fine and good. And, you know, and that's where it's all the things about staying healthy and getting enough rest and, you know, and so forth. But coping doesn't change the stressors. Mm-hmm. So it's just helping you to deal with the fact that the job is stressful. And if you're going to ever get to the point of preventing or reducing the risk of burnout, you really have to be focusing on the causes, not just the effects. And so prevention is much more about what do we do to alleviate the stressors, remove them, make them less harmful, less frequent. I mean, there's a lot of ways depending on what those pebbles are, you know. But you need to have that as much as you need to have the coping, because the coping often is helpful in the immediate, and it's often a short term, but it's not something for the long term. So for example, recently I was, you know, earlier this year, I would get a lot of things from people in different organizations saying, you know, not healthcare, because healthcare doesn't sort of fit into this category, but how about we just take off for a whole week? Okay, we'll just shut the company down for a week, and everybody will be off, and then we'll come back and we won't have burnout anymore. Maybe you might have a vacation, depends what you do. Maybe you get some rest and recovery and so forth. But if you come back to the same job stressors after a week, it's gone. Burnout is back again. And, you know, if you're working in situations where there's really not any kind of an off time, I mean, people will say, yeah, sleep more. Well, tell me, how can I do a job that's not taking up all my time at sleep and on the weekend, and I come home and I work late, you know, or whatever. So, you know, the coping is fine, but we need more attention to those larger systemic issues, because those are the why, those are the causes, those are the things that will have a long-term effect. Mm-hmm. And we just need to kind of, you know, it's not like doing some massive billion-dollar thing of changing healthcare for the 21st century. It's doing the little stuff, the daily stuff, the chronic job stressor, pebble in your shoe stuff that will kind of make it a better fit, make it a better environment. People can thrive at what they're doing rather than get beaten down by the job. And that's really the approach that we're trying to take in terms of this relationship between those immediate job conditions and the people who are there trying to do their very best.
Well, yeah, and that goes back to change management that you go, and I'm going to keep pulling up.
Keep showing the book.
Everyone, but it's a great book. You should order it immediately. I love it. But I'm a big fan, obviously. Yeah. But yeah, you know, you go into change management, you know, it's really about, you know, when you as a system, when you decide to pick a few things on the front line that are really causing pebbles and shoes for everyone, the little annoying things every day, like not enough PPE, or we're always short-staffed to one medical assistant, and it totally messes up the flow for the day. You know, when you address little things on the front line and people start to see change, like you said you were going to do it and you did it, and now it's better. Oh, actually, it's possible.
Yeah.
And it's like a reward, you know, it kind of is encouraging and hopeful and inspiring, and you get buy-in from everyone on the change management process. So they have to see results. Otherwise you don't get buy-in. Yeah, no, those are excellent points. And I think it does build hope and it builds optimism. If we could fix that, hey, we could go, but how about this over here, you know? So you want to start actually, in a sense, small. That doesn't mean unimportant, but things that are doable, that are clearly on people's list of, could we do something about that? And making that happen and say, you know, there is a way in which we could improve things. And it's much more of a, if I can point this out, it's much more of a we process and not just me, you know, what can I do? Which coping tends to be more of that, not always, but how can I take care of myself? What do I do for myself?
But when you're talking about the job conditions, you're not working in a monastic cell, you're working with other people. And so if there are changes, it's kind of like it's got to be something that is we're all on board to kind of move over and make it happen this way and get rid of the stuff over here that's doing it. So it needs to be a more social, shared, our work environment kind of thing, which means, I might add, that the maxim that you often hear that one size fits all, not. No. Yeah. There is no one thing, I don't care what it is, that will work for everybody in the hospital or the clinic and the different units and stuff like that. And you have to customize to who we are and what we're doing, kind of thing. And there may be, which we hope to sort of lay out in the book, some generic principles that are good, but how you implement them really has to be something that takes into account, where this office, this testing facility, this, surgery unit, this pediatric, whatever. But it can be done, and we see it being done. And it's really, and it gets people involved, but it gets people feeling like they're being heard. And they have a say. They may not come up with the best idea, but at least they're involved in sort of thinking through what are the pros and cons of doing it, A or B or C, and which one do let's get behind this one and see what we can make happen.
Yeah, well, you're really talking about a collaborative approach to changing our culture of medicine and healthcare too. And it takes everyone, and everyone has a good idea. Everyone has a perspective that could be really beneficial to the organization. So I think including everyone, especially on the front line in decision making and process change is just foundational.
Yeah, it is. It really is. And in that regard, I might add that I don't know if we have a different name for it now, but it used to be that we would talk about walk around leadership. And walk around leadership meant that the people in the C-suite, in the higher ups, whatever, made regular trips to the different units and the departments. And it's, in a sense, it's walking around the floor where people are doing the work that needs to get done in this place and getting to know people, and they getting to recognize and know them and be able to talk about how are things going and where are we running into some problems. Are there some thoughts about, what we could do differently? Things are going well, wonderful, I'm proud of you, all that kind of stuff. And it makes such a difference because then people feel on both sides that they're known, that they're recognized, that they have a place to participate and contribute. They know where to go. If they run into stuff, they can count on their first line managers or who will take some of the issues up to say, we need to do this better. It still makes a huge difference. But I often have gone into different, places to do interviews and get data, and it's not happening. People are asked to fill out a survey once a year, maybe, on various things. Never hear back, never know what's happened. After a while, say that forget the survey, I'll just make it up, and it's not helping, to us to do a better job under these circumstances. And even when things really got bad during COVID, particularly in healthcare, and people's like, it wasn't even clear what the protocol should be, what the evidence base was, whether, how much at risk you were yourself, for getting this, for passing it on. I mean, all of these kind of things. Just knowing that everybody, is particularly upper leadership, is behind you trying to figure this out, work with you to, say, how are we going to, move forward on this? So it's really, I can't emphasize how important that sense of collaboration at all different levels is. So it's not just top down, it's bottom up, it's sideways.
Absolutely. And I want to bring up Dr. Paul Lachant. He's one of our friends and colleagues, and he actually specializes in one aspect of this in terms of implementing huddles in which management attends. There's leadership training for everyone, and it's top-down, bottom-up leadership approach where things get mentioned that need to be changed on the front line, and then they actually get changed. So everyone gets that immediate feedback, and things are in place to support that change process.
Right.
So I think that's a really valid point, Christina.
Yeah, and it's great that he has been able to bring that, from someone who has both a MD and the business expertise, to that, to really look at issues around, burnout and physician burnout in particular. Yeah.
Well, so one of the things I wanted to talk with you about also is, you talk a lot about an ideal job and person match throughout your book and in your talks. Can you talk to us about what are the top mismatches between a person and their job situation and what would be an ideal match?
Yeah. Knowing that we never really get to an ideal because there was always shifting sands, but you're always striving to, could it be better, than what it is. So what has come out in the research so far is 6 different areas in which a mismatch or a bad fit between people and their work environment, their job conditions, a bad fit leading to a greater risk of burnout. And conversely, if you get a better match and work on that, then you're promoting the possibility of greater engagement, with the job. So these 6 areas, and I'll name them in order of how well known they are, I think, and any other thing, but they're all important in different ways. So the one that everybody thinks about first is workload. And you've got too much to do. And as I mentioned, the imbalance there is that the demands are high, but the resources that you have to get it done and done well are low. And so people have too much to do. There's not the stuff, like you were saying, especially early on in the pandemic, of protective equipment and, all sorts of things that just, are difficult. What you want to be aiming for in a better match is a sustainable workload. It's like there are days where you're working hard. There are days where you have lesser kind of things. There's a way in which you have enough time to recover, come back ready to go the next day and feel good about that. So the workload clearly has a really direct impact on exhaustion and the stress if it is just out of line. But the thing that people often say about workload is really the second area. And these, by the way, these 6 areas overlap. They're not independent of each other. But the second thing is control, having some sort of autonomy, control, discretion, some say about how you do your work or how you have to course correct if something unexpected comes up, that kind of thing. Or are you locked into, you have to do it this way, you can't do it any other way. So people are often talking about an uncontrollable workload. It's not how much work there is, but the lack of, some authority and autonomy that I bring to it based on all the training I have to do this kind of work. And, and people, I think this is control more than workload, but control is really an important one in healthcare. And it's been getting worse for many years, even pre-pandemic. So that's an issue. And better match, you want to have some sort of appropriate level of say and and choice and ability of doing things. The third area is what we call reward, and that is positive feedback for a job that's well done. So you work hard, you do various kind of things, you've done some special things, and does anybody notice? Does anybody pat you on the back? Do you get social recognition? People often think of reward in terms of money, like salary or benefits, but it turns out in the research that the recognition is the thing that keeps popping up a lot, saying and I would often, when I would early on in my interviews, when I'd be talking with people in healthcare, human services, say, so tell me about, what's a good day? Tell me what's a bad day, that kind of thing. And a good day, people would often kind of pause. A good day. Nothing bad happened. That was about as much as you could say.
Oh,
You know,
no.
I remember talking to pediatric
Oh.
dentists, and there was a pause and it said, no screamers. Okay. So, it's not that there were good things happening. It was the absence of bad stuff, which meant that normally you were having a lot of bad stuff. There were complaints or whatever, that kind of thing. Or people say, why? That's your job. Why am I supposed to say thank you? Come on. So that kind of recognition, this sort of sense that you have made a contribution, that people are pleased and, proud of it, that they've learned from it, that, you have a place there, is really an important thing. Fourth area is what we call community, and it means the workplace community. So it's whose people, what other people have paths that you cross, often. So there's colleagues, there's your bosses or managers, there's the people you supervise, there's, the other people on the team, that kind of thing. And is there trust? Is there support? Is there willingness to, when we disagree, to figure out how we're going to come together and move forward? Or is there what people have been calling increasingly in recent years a socially toxic workplace, where there is uncivil behavior, nasty remarks, bullying, harassment, lack of trust and support? You have a sense that people will throw you under the bus if you say anything like, oh God, I'm not sure that worked so well today, kind of, oh, okay. What's wrong with you? You're not, you're not perfect, whatever. And we know from psychology, other social sciences, that one of the most important things for human beings to thrive is to have other people, your family, your friends, your neighbors, your colleagues, wherever, that you can rely on. They can rely on you. You exchange things, your friends, you do things, bad stuff happens. We figure out how to fix it, that kind of thing. And when that, I can't say social network anymore, then that social ties between people begin to get eroded through through this toxic workplace community, then people can feel very, very alone, isolated, no help, nowhere to turn, because they're worried about what might happen if they disclose that I'm feeling stressed, or I've had a bad day, or I could use some help, or can I just cry on your shoulder, or whatever that is. And that was happening long before the pandemic, but it's certainly one of the things we hear about a lot. And I remember, if I can just take a moment, visiting pre-pandemic pediatric hospital. They asked me to come and speak and do stuff. And I remember they had set up, in addition to a talk, there was a lunchtime meeting with physicians, and food was all laid out. And they brought me there, and I was waiting, and in came everybody, and everybody started going, oh my God, I haven't seen you in how many weeks now? How's your son doing? Did you do da 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 da? And people were hugging, and they were laughing, and they were, everybody was talking to each other. And the staff member came over and said, "Oh, Dr. Maslach, I'm so sorry. They're not paying attention. They're all getting." I said, "Let it go." I mean, for a little bit. And I finally they kind of all settled down, and I said, "You guys don't see each other very much, do you?" And they just broke out into this hysterical laughter about, no, we don't anymore. Wow. We're not seeing each other over lunch or break or coffee or after work. We are too busy. We are doing other stuff that has to get done. So I don't see people. I sit at my desk, or I sit wherever and get out of a bag lunch, or, whatever. And what they were saying is clearly love getting together with colleagues who just, not only about work issues, but just about getting to know each other, so we know who I can turn to when I need somebody to go to. Or they've been put in different units, and now the physical barriers to, actually meeting each other have gone down. And it was striking, how they were all working in the same place, but they were not able to get together very often, if at all. And we had a big discussion about, what are ways we could build this in to their routine and all the other things that they had to do. So that community is an important thing. The fifth area, fairness. So whatever the rules, whatever the processes, the practices, they're fairly applied to everybody. So people have the same chances to get ahead or get the window office or to get the new assignment or a new opportunity that comes along or something like that. When it's unfair, when people are being treated unfair, this is where discrimination lives. This is where glass ceilings are. This is where the wrong people are getting rewarded in a sense. They're cheating. They're kind of, lying, brown nosing, or whatever to get ahead. And the cynicism can really begin to skyrocket when people are working in these kinds of environments and feeling, wait a minute, this is not, we're preaching something, but we're practicing something else, which is really different. So that will lead people. We can make changes there too, but some people will just leave. And then finally, the last sixth area is values or meaning in work. And this is, in some sense, why am I in healthcare? What did I want to be able to do and accomplish and contribute and help? And, why is this the choice I made that I believe in? And if I end up working in an organization that kind of supports those values of, really making sure all children are healthy and get a good start in life, or, when people have problems that we're able to provide, some kinds of treatments that help them understand what they can do differently, et cetera. They get injured, we can repair and bring back to better health. But if you're working in an environment with ethical conflicts, where you're caught in those kind of things, where people are not kind of abiding by what we preach and what we believe in, and in healthcare, I've seen a lot of this recently. Moral injury. When people talk about this, they're talking about how I have to do things that feel really bad or even wrong. And it's not because I'm doing it, I'm choosing to do that. The system is forcing me into that kind of position. So it's the moral injury. It's, as you know, in the book, I used one example of an emergency doctor who had a career in the military, came and worked in a hospital and burned out, even though it looked like a good job and was paying well. And she just said, the reason they want me there is to make money. And that's not why I went in. I'm being treated like a worker bee. I can't do this anymore. And she finally left. She quit, and this happens often with people in the value conflicts. And she took another job where she's working in a children's hospital at a pay cut, but she feels like, yes, this is why I'm here. This is why I want to, the kind of environment in which is better for me to do the work to help children. Before it was, soldiers, in the battlefield. But so those 6 areas, workload, control, reward, community, fairness, and values, are the 6 in which, you want to assess what's working well and where are they, and there is some trouble, or things that we could turn around. And sometimes it's unexpected. People keep saying, oh, it'll be the workload or it'll be the reward, because people complain about salary. Sometimes it turns out it's fairness. Sometimes it turns out it's, Michael Leiter, my colleague on this, has done a lot of research in hospitals in Canada, particularly not just physicians, but often with nurses, around issues of civility and how we treat each other on the job. Mm-hmm. Should be our closest allies because we know what we're going through, and yet sometimes we become each other's worst enemies and really not so anyway, and can you turn that around? All his research says we turned it around in 6 months, turned it around a year. You look again, it's a year later, still looking good. And so it's possible to make improvements in that.
Well, you're an optimist, Christina, and so am I. So that's why I call this podcast Hope for Healthcare, because, despite all the things that aren't going well in healthcare, we do a lot of things very well. And we are also committed to this profession especially the frontline workers and healthcare workers. So I do believe that we can make a difference. I think as an individual clinician, if you read this book, it might give you some ideas on your own, understand your values and what you want in a job. And if, there's a couple things that need to change for you to feel more content and joy, and that's possible, work on that. But if it's a definite mismatch in all 6 categories, consider a different employment opportunity that would be more of a match. So I think I just wanted to bring that up because I think it's ideally I want everyone to try to work with where they are, but that isn't always the case, and so sometimes we don't want to lose people out of healthcare. So
no, it's true, and it's the other thing I just want to say is that I have found over the years, particularly in talking with people in healthcare, I've often asked afterwards, if ever you come across something or you develop something or you're part of something that seems to make a difference, let me know, because everybody asks me, what's the answer? And I don't have it necessarily for what do you do in this kind of setting. I can talk more generically about, okay, what some of the issues are and so forth. And so some of the things that we talked about as examples in the book came from just that, people contacting me after we met at some, healthcare conference or, whatever, and say, can I tell you what we did with our team? I said, yes. And then they just, they developed something they called a cuddle huddle. And it was kind of like, it solved a number of these issues that they hadn't even really thought about. But now they recognize, oh yeah, it happened by accident, but we figured out a better way to work together. And now it's working more effective. Great. Let me pass this on, like in this book or wherever, that they recognized where some of the mismatches were and made some changes that actually helped. So.
Well, and I know we're kind of winding down with time, but Christina, is there any message that you want to leave with our audience today, or anything that I didn't get a chance to ask you that you'd like to? There's so much, right?
So there's a lot. And I think one of the things is that understanding that burnout is not a pathology or a disease, that it's actually a good response to stressors at first. But because it's chronic stressors, it's not a good, our bodies were not really meant, we as human beings were not meant to be under stress all the time. So that's where the problem becomes, that the coping, is not actually getting you into a better place, to be functioning in some way. That understanding that relationship between you and other people and the job, and looking for where are the things working well, where are they not, using those 6 areas as kind of guideposts to think about the community, or think about reward. I hadn't really, in the recognition, or think about fairness, may give you some new starting points, some things that say, we could do something about there. The other thing I would say is, and again, I think this is a healthcare concept that we need to sort of share more broadly. And that is that we should be doing organizational health checkups, just like we do personal individual health checkups. And a checkup means you're going in to see about how you're functioning, in many ways, not because you're sick, not because you're injured, because there's an emergency or a crisis. It's just to see how you're doing. Is things going well? Are there some warning signs? Is there some suggestion that you may need to do this or that to be healthier, or we're beginning to see, whatever, that kind of thing. And so with the organizational checkup, we shouldn't just be responding, oh my God, we're in crisis. That's not the time, to do this, but to, again, have a regular time where we sort of say, how are things working? What's going well? What could we even improve upon there? But what's not? The world will always be changing. We just saw that in a big way in terms of the COVID pandemic, but it always does. The way I used to teach and other people taught 50 years ago, not the same as it is now, given all kinds of new advances in how we understand learning and technology and all, So you always have to be sort of adapting to get a better fit, a better match between here's the job and here's what we can do. And now we have something new, so we don't have to do that. We could do this. So it should be that continuing process of checking in and seeing how we're doing. And it should be a regular agenda item that however often you think it's necessary, but a few months, every year, whatever, to sort of do kind of a spring cleaning on our whole work process. What can we get rid of? What can we change? How could we improve it? How can we make it as good an environment as we can for us to do as good a job as we really want to do and can do and have been trained to do.
Yeah, and I really love your term organizational checkup. I think that's a great metaphor for preventive care, right? That's why we have our annual checkups for preventive care. And within, you've given so many solutions today and through your writing and through your other books as well, that if organizations have a framework and a roadmap of what they can do when these little things come up during the evaluation, it's less intimidating and overwhelming.
Yeah. The other thing in alignment with that is that, as I mentioned before, there's often such a stigma about disclosing any kind of stress or, mental tribulation or, whatever kind of thing. And people have often asked me, okay, so do I have to go to my boss and say I'm burned out and, disclose and ask for some accommodation or something like that? And basically my answer has been no, because I don't think that's the most effective way of doing it. You're just going to get the the pointing at the victim and, all that, what's your problem and kind of thing. But you don't need to disclose burnout in order to say, can we start a better process of checking in and making sure that we're improving the work conditions, on a regular basis. So it's not about saying who's burned out. It's kind of saying we all would like to be able to, do well and thrive here. And can we have a way in which we kind of routinely do more of the preventive care that you're talking about? So that takes it off individual people's shoulders as, oh, I have to be the one who says I'm burned. Am I the only one who's burned out because nobody else is, that kind of, no, you don't need to start improving the workplace by having burnout first. It's, we talk in the book about an analogy that burnout is more analogous to the canary in the coal mine, in the sense that it's not about let's fix the bird and make it, tougher and tell it to take a long weekend, it'll be okay, kind of thing. The bird is telling us this is not a great environment. It's a signal. It's a warning sign. And burnout, in some ways, we know that a lot of people may not be completely burned out in the terms of those three things, but enough less than wonderful, less than engaged, that they could profit as well, by whatever kind of improvements we could make in the environment. And so in some sense, if we kind of reframe the question, not about who is burning out, but how do we make workplaces a better place for everyone to do well, then rising tide lifts all boats. Why not? Kind of thing. So burnout, again, is the clue, or maybe pointing. The challenge is to actually fix those relationships between people in their jobs so that everybody, is feeling better about what they're doing and having a good life.
Well, absolutely. And, I urge everyone again, it's called the Burnout Challenge, and it'll be launched November 15th, 2022. So coming up in a few weeks, and I will be providing the links so you can order the book if you're interested, and all the information that we talked about today, and how to get in touch with Dr. Maslach if you have any questions as well.
Okay. Yeah.
So, well, thank you, Christina, for such an enlightening, inspirational conversation. And, you're just such an optimist, and you have so many ideas of how we can really heal our culture of healthcare. And I'm grateful for the work that you've done over the past 5 decades and that you are continuing to do for our community.
Okay. Well, thank you so much for those kind words. I really appreciate it. And I am just happy by your reaction. You're, being able to connect all of us in ways that I hope will lead to better outcomes for everybody. Thank you so much for inviting me.
Oh, my pleasure. It's my hope too that we, together as a community, we can make change. And again, I'm so grateful for you being on the podcast today. And I look forward to hopefully seeing you at the next conference.
Okay, we'll
All
do that.
right.
Okay.
Thanks, Christina.
Thank you so much.